Elite male volleyball, physiological attributes, and a comprehensive testing battery. Energy system development is critical in elite male volleyball, which includes both the ATP phosphocreatine and the aerobic energy systems to be working effectively. A well-developed aerobic energy system appears to differentiate international volleyball men from university level, while the ATP phosphocreatine energy system is paramount for the explosive abilities required for vertical jumping. Key physiological and neuromuscular attributes that augment volleyball performance include strength, vertical jump ability, which appears to be a predictor of elite volleyball performance in male volleyball, change of direction and agility, speed, and power. Energy system requirements. Volleyball is an aerobically dominated sport interspersed with high-intensity bouts of movement. Casabalas et al. Demonstrate this reliance as 95% ATP-PC and 5% from glycolytic pathways. Morosic et al. Demonstrated that elite volleyball league players covered approximately 1,750 meters in a 4-set match, with an average movement of 10 meters per rally. These findings support a work-to-rest ratio in which free fatty acids are utilized for energy. The hydrolysis of phosphocreatine in the ATP-PC energy system is relied upon during maximal sprint, change of direction, and jumping actions, which typically last 2 seconds or less. Intensity is the primary factor related to energy system utilization, and since maximal jumping is very high intensity, the ATP-PC system is utilized. The aerobic energy system is used between high-intensity periods for restoration of energy sources, and appears to be critical in top-level volleyball. This type of movement relies on free fatty acids, as post-match concentrations have shown to be increased in elite volleyball males. These findings support a work-to-rest ratio, approximately 11 seconds on, 14 seconds off, as described by Shepard et al., in which free fatty acids are utilized for energy. Blood lactate accumulation doesn't appear to occur to a great extent throughout professional and elite volleyball matches. The free fatty acids undergo beta oxidation within the mitochondria to produce ATP. The increased availability of free fatty acids in the blood prevents the body from using glycogen, therefore keeping blood glucose high enough throughout volleyball matches and thus limiting byproducts such as lactic acid. Figure 2 denotes time course changes of blood lactate concentration. Vertical jump is essential in volleyball. Multiple authors have found higher-level male volleyball players perform better in vertical jump tasks such as spike jump and block jumps. The differences were not attributed to differences in anthropometrics, but rather better jumping ability. Zivinledor, 2010, discovered a similar trend in first division versus second division male volleyball players in Belgium, and that higher the level, the higher the volleyball players typically jumped. Shepard et al. Demonstrated that during a rally lasting 12 seconds on average, setting and attacking players performed a minimum of 1 jumping movement. For details, see Table 1, which denotes ranges of numbers of block jumps, spike jumps, and jump set frequencies per set in an international elite men's volleyball match. Strength training is transferable to vertical jump ability. Multiple authors bring to light the relationship between strength, or maximal force production, in relation to vertical jump. A moderate correlation between 1 RM back squat and both counter movement jump and relative spike jump were found by Shepard et al. 2008. These authors demonstrate the need for high relative force application, power generation, and velocity production capabilities for elite level volleyball performance. Hartman et al. 2012 found that only the deep front and back squat showed statistically significant improvements in counter movement jump performance by 8.29% in the front and 7.79% in the back squats. As shown in Table 2, results indicate that vertical jump peak power is strongly associated with weightlifting ability, including squat strength. To note, these authors did not denote what type of squat was being used in the study. Individuals that performed heavier squats achieved greater jump heights with a counter movement and static jump, and these jump heights were significant predictors of peak power output. Therefore, 83% of the variance seen in the peak power of the counter movement jump and peak power of the static jump can be attributed to squat strength. Strength is transferable to speed and change of direction. It was concluded in a meta-analysis and systematic review by Seitz et al. That there is a transfer of lower body strength training to sprint performance. It was also demonstrated that high correlations exist between counter movement jump and 10-meter sprint time, along with squat and 5-meter sprint time. Hori et al. Discussed how multiple contributing factors other than strength relate to change of direction, but the highest statistically significant correlation was between front squat 1 RM, strength, and change of direction. Also of interest in Table 3 is the high R value between sprint and front squat 1 RM, where 36% of the variance in the speed can be attributed to front squat strength. Application of findings. High performance vertical jump ability is produced through well-developed force and velocity characteristics. A mixed method resistance training protocol is recommended for improving sprint performance. Figure 3, Part A denotes a mixed method approach in which a variety of loads and exercise types are used in a periodized fashion to optimize power output. Figure 3, Part B through D break down each component of this protocol in terms of the force-velocity characteristics targeted. In a review of change of direction studies, Brugeli et al. Concluded that improvements in change of direction performance have utilized exercises that more closely mimic the demands of change of direction. Examples include horizontal jumping, such as broad jumps, and general change of direction training. Volleyball injury analysis. In a systematic review, it was determined that both acute and overuse injuries are common in volleyball. A large-scale study performed on professional Spanish volleyball players showed that the most frequent sites of injury were the ankle, shoulder, and knee, as seen in Figure 5. Figure 4 denotes injury location during different volleyball movements. Kilich et al. Found that typical acute injury is an ankle sprain, whereas knee and shoulder injuries occur as both acute and overuse. Exclusive to acute injuries, knees accounted for 33%, 70% ankles, 17% shoulders. Regarding overuse injuries, 24% were knee and 12% were shoulders. Overuse injuries. Patellar tendinopathy. It can be defined as symptoms isolated to the inferior pole of the patella, but historically has included symptoms anywhere along the patellar tendon. Subacromial or rotator cuff impingement occurs with a narrowing between the acromion during overhead movements with internal rotation of the arm. Suprascapular neuropathy is a consequence of entrapment of the nerve where it passes through the coracoid notch, causing repeated stretching during abrupt movement of the scapula. Figure 6 demonstrates that the research is focused on tendinitis and suprascapular neuropathies in elite volleyball players primarily. Overuse patellar tendinopathy. Multiple authors have concluded that an abrupt increase in training volume is the primary mechanism for developing patellar tendinopathy. Hard surfaces also appear to play a role in the development of this condition. De Vries et al. Determined that individuals who have grown are also at increased risk. Overall, increases in match exposure was the strongest sports-related predictor for developing jumper's knee. There appears to be no concrete treatment for patellar tendinopathy and high variability in the protocols available. In the Kilich et al. Review, they state that preventative measures remain scarce. Kumps et al. Note that individuals with anterior knee pain typically show weakness in the quadriceps, hamstrings, hip adduction, and hip external rotator muscles. These must be emphasized in strength and conditioning programs. Overuse subacromial impingement and suprascapular neuropathy. Factors leading to functional subacromial impingement. Overactivity of pec major and minor resulting in anterior forces of the glenohumeral joint and reductions in scapular upward rotation, external rotation, and scapular posterior tilt. Muscular imbalance between the deltoids and rotator cuff can lead to reductions in subacromial space, an increase in upper trapezius activation, and a decrease of middle and lower trapezius, along with reductions in serratus anterior. And lastly, a reduction in the subacromial space due to inflammation leads to a reduction in rotator cuff activation. As an example of alterations in glenohumeral and scapular kinematics, Tehan et al. Demonstrated experimentally induced fatigue of the rotator cuff leads to superior migration of the humeral head at the initiation of abduction. Factors leading to suprascapular neuropathy, we have entrapment of the suprascapular nerve where it passes through the coracoid notch. This results in atrophy of the supraspinatus and infraspinatus muscles caused by neural lesions. The kinematics of the shoulder are very complex and require fine balance between the stabilizing muscles of the glenohumeral joint and the scapula. Therefore, strength conditioning must emphasize strengthening of the appropriate muscles to balance the overuse factors associated with the overhead athlete. Cookie-cutter programs for the overhead athletes do not consider the muscular imbalances for each athlete. Therefore, specific programming must be considered for these athletes. Acute volleyball injuries. The typical mechanism for an acute ankle injury is the zone beneath the net where players make contact one another, and inversion ankle sprains are common. 80% of sprains involve the previously injured ankle, and an individual is 10 times more likely to suffer an ankle sprain on the same ankle. Furthermore, according to Reeser et al., the risk of injury is greatest within the first 6 months of the previous injury. Verhagen et al. Demonstrated significantly fewer ankle sprains in the intervention group that performed ankle balance board training pre-practice, as shown in Figure 8. This is one example from this protocol where single leg stance can be used to catch and throw a ball from the balance board. Injury analysis conclusions. One recent epidemiological study looked at elite volleyball men, and although 90% of the athletes participated in injury prevention programs, the common injuries described previously still occurred. As one author concluded, preventative strategies regarding volleyball injuries and the scarcity of research supporting effective preventative measures is lacking. Injury trends are well established, however, further research is required to establish normative protocols for injury prevention and rehab in the volleyball setting. The complex requirements of the volleyball athlete will mean that research will continue to evolve and provide better guidelines due to the popular nature of the sport. The key attributes assessed in this protocol are evaluated in order of non-fatiguing to fatiguing tests according to Half and Kendall. The ATP-PC system typically requires 3 to 5 minutes for complete recovery, and the glycolytic system takes up to 1 hour for recovery. Therefore, high-skill movements such as agility and vertical jump are assessed first, and on a separate day than maximal strength and aerobic or anaerobic measures of endurance. Linear sprint is measured on day 4, since according to Half and Kendall, it must be assessed after maximal strength, and in this case, it's located here due to logistics. The specifics of each testing protocol are beyond the scope of this presentation. However, standardized measures are described in the literature for each test and are all deemed reliable and valid. Day 1 does not require energy system utilization. Day 2 and Day 3, predominantly ATP-PC. Day 4, a mix of all energy systems, as the evaluation is meant to assess volleyball needs. This is an effective way to measure the combined usage of all energy systems simultaneously in a volleyball-specific manner. Day 1 testing. Anthropometrics using a bod pod. Height, body mass, and fat-free mass are evaluated using the two-compartment model. This method is deemed as reliable and valid by Kerr 2017. These authors state that the bod pod two-compartment model assessments are highly influenced by subject presentation. It's clear that standardized presentation can minimize biological variables, which these authors state is the biggest contributor to measurement error. They conclude that the bod pod is a suitable method of assessment if standardized presentation is not possible. This is often the case with athletes, as many factors can influence their day-to-day presentation of biological variables. The landing error scoring system, or the LESS, is a visual assessment of an athlete's landing biomechanics using a two-camera evaluation and a subjective evaluation. It's deemed as a reliable and valid evaluation of jump landing biomechanics by Padua et al. Specifically, this test is described as being a count of landing technique errors on a range of readily observable items of human movement. For this test, individuals are instructed to begin on a 30 centimeter box jump away from the box to a distance of 50% of their height. Once the individual lands, they are instructed to jump as high as possible. The Y balance test is a 3-direction balance test measuring the anterior, posterior medial, and posterior lateral reach distance. It is deemed as reliable and valid by Smith et al. However, further research needs to be completed regarding the validity of the star excursion balance test lower quadrant, which is where the YBT is derived from. Its precursor, the star excursion balance test, has been deemed valid regarding non-contact injury. Asymmetries of greater than 4 cm appears to be associated with increased risk of non-contact injury in a sample of Division I college athletes. These authors state poor performance on dynamic balance tests is associated with an elevated injury risk. Butler et al. Day 2 testing. Absolute reach. The 4 measures of absolute reach are single arm standing reach, double arm standing reach, absolute block jump, and absolute spike jump height using the Vertec vertical jump measurement tool. These 4 measures are very important as absolute height above the net in volleyball is critical for success when blocking and hitting. It is deemed as the least reliable by Nuzzo et al. 2011 of the measurement tools evaluated in the study. However, Vertex are the only measurement tool used to evaluate reach heights. Lower body power output measurements. This includes static jump and counter movement jump using a contact mat. These are deemed as reliable and valid measures of lower body power. To determine a reliable and valid vertical jump measurement of both a static jump and counter movement jump, a contact mat is recommended. The vertical jump displacement is calculated by the contact mat from flight time, while the peak power output is calculated using the Sayers equation above. The eccentric utilization ratio can then be assessed based on differences between jump height values of the counter movement jump and the static jump. Upper body strength and power. A seated medicine ball throw using a 2 kg medicine ball has been deemed a reliable and valid measure of upper body strength and power. Participants throw the medicine ball forward in a straight line and as far as possible, with head, shoulders, and back maintaining full wall contact. Lastly, agility. A t-test will be used to evaluate change of direction and planned agility. It has been deemed a reliable and valid measure of planned agility by Rea et al. 2013. Day 3 testing. The deep back squat is used to measure lower body strength, while full body power and strength is evaluated using the hang power clean. The specific testing protocol recommended is outlined in the Essentials of Strength Training and Conditioning textbook by Beichel and Earl, 2008. Day 4 testing begins with a 10-meter sprint. The 10-meter sprint speed will be used as an evaluation of the athlete's acceleration and linear speed. Bond et al. 2006 found a microprocessor-based single-beam timing system to be a reliable method for evaluating the speed. Endurance Testing 1. The Volleyball Intermittent Endurance Test, or the VIET, is an aerobic conditioning test deemed to be reliable and valid by Rodriguez-Morayo et al. This test is described further on the next slide. Endurance Testing 2. The front court play test is a repeated effort, a volleyball conditioning test using an adjustable apparatus and movement course. It has been deemed reliable and valid by Shepard et al. 2007. This is also described on the next slide. The protocol for the VIET is as follows. The athletes are instructed to run a circuit around the court using volleyball-specific patterns, including a forward run, lateral movement, and backward run with repeated runs of 177 meters, or 3 laps at 59 meters per lap, with progressively increasing speed, in Figure 9. The speed is dictated by audio bleeps. Between each stage, the individual has 30 seconds of passive rest, and each stage has an increasing speed of 0.6 kilometers per hour. The subjects continue until volitional exhaustion, where they can no longer reach the cone in time twice. The protocol for the front court play test is as follows. The yardstick is set up in between the net and the 3-meter line, 1.5 meters from each and 1 meter from the sideline. 2 timing lights are set 1.5 meters apart, 1.5 meters from the sideline. Another set of timing lights is set on the 3-meter line, 3 meters apart, with the leftmost tripod set 1.5 meters from the sideline. An adjustable apparatus incorporating a large tripod with a 2-meter horizontal pole is placed on the opposite side of the net, with the middle of the tripod in the middle of the court. Volleyballs are permanently mounted on the outermost points of the 2-meter horizontal pole. The athlete starts 4 meters back from the net. The athlete begins by performing a spike jump and registering his maximum effort on the yardstick. This is quickly recorded by a tester, and the vanes reset. The athlete must then land at the net and immediately move right along the net, and hence begin timing. He then performs a block jump on each of the 2 mounted volleyballs, then moves further right until he gets his outside foot onto or past a tape line 1 meter in front of the rightmost boundary. The athlete then reverses the entire process, including the jumps to both volleyballs placed on the tripod. After touching the second volleyball in the reverse direction, the athlete then moves backward and diagonally toward the 3-meter line, using an open step typical of volleyball. As he passes the 3-meter line, he stops the second set of timing lengths, but stays in motion, rounding a 2-meter high pole marker, and immediately performs a second spike jump on the yardstick. This entire sequence constitutes 1 rep of the 4-rep test.